support from makers comes from Clive Daniel Home and by Chico's.
I was diagnosed with Hodgkin's disease, and it was in 1976. It was the summer between my 2 years of graduate school, and it was that experience that led me to find this program called Hospice and really motivated me to make a difference and to change the healthcare system. When I was diagnosed, something that I came to understand very quickly was the fact that the healthcare system didn't really provide love and comfort to people. I had the opportunity to really be in the very beginning of hospice care in this country and help to formulate how it was going to be provided in the United States. So I took what was a very difficult situation for myself and my family and looked at what I could do. And what I could do and what I wanted to do was to change the healthcare system for people with serious illness. When someone had cancer, they had a great deal of pain. There was no emphasis on helping take care of their families. It was kind of a quiet disease, and nobody even wanted to say the word cancer. And unfortunately, many of the people who were in treatment at the same time that I was, they didn't survive their illness. I always seemed to have to speak up about situations. So I don't know what would have happened to me if I stayed in Lebanon. I think I would have not had the opportunities because they don't exist. I would have fought to try to create those opportunities, because one thing I've always thought about ever since I was a little girl is the fact that when I look at something the way that it shouldn't be, I want to change it. And I believe that came from my experience with my mom and my dad. They wanted to change things, and I picked that up at an early age. And I was able to grow up in Columbus, and my mother and my father were very focused on education, and they wanted us to receive the best education possible. We knew from a very early age that we were going to college no matter what. And so I had the opportunity to go to the Ohio State University and graduate with both my bachelor's and my master's degrees. We were caring for about 50 people a day, and we also had no opportunity to really have a robust organization. We were in the red, and so I really quickly wanted to look at how we could expand our services and educate people about what we can do for them. It's a topic that most people don't want to hear about. Most people don't want to think about the final phase or chapter of life. So I had to very quickly start educating doctors, other healthcare providers, and the community in general about what we really do in hospice care. So many people, when they think about hospice care, they think about dying, and they think about sadness. And what we really do at Hope Hospice is to help people to live as fully as possible every day that they have, as comfortable as possible. So we focus on pain control and symptom management. We also focus on helping people with their fears and the emotional and spiritual care that they need so that they can have as fulfilling a day and life as possible. We also help the family. They can feel as though they had the opportunity to say everything they wanted to say, to do what they wanted to do, and to know in their heart that they did all they could for their family member. Hope Hospice, we have the opportunity for most people to be cared in their homes. In fact, 80% of the people in our care are provided their care in their own home. Then we also have a number of people who may be in a nursing facility, and we help to care for them in those settings also. And then we have our 4 hospice houses, so that if someone can't be at home or they're more comfortable in an inpatient setting, they can be cared for in one of our hospice houses. There have been times when I've actually had people say to me, "Oh, You don't know anything about construction. You don't know anything about balancing a budget. You don't know anything about so many different topics. There is still some people who think that when an organization becomes larger or when there are certain challenges, that you have to bring in a man to handle it. And at the same time, I really believe that there are many people who don't believe that. It's important to enjoy what I'm doing every day. And I love what I'm doing. I love making that difference. So when I'm at work or when I'm working, I don't necessarily feel like I'm working. It's important that we take care of ourselves. And so I really try to have that balance with taking care of myself, my family, being involved. When I think about how I would like people to remember me, I'd really like them to think about the achievements. And I'd also like them to think about trying to be as nice as possible to as many people as possible, and to think about the fact that I help to make a difference for people in our community and people really across the country.
Support for Makers comes from Bank of America and by Cypress Cove,